All right, let's learn about the pulp. So if I show you a picture of the dental pulp, this is what we're looking at right here. The most inner portion of your tooth is the pulp. It's actually soft. Later on in the slide, we'll learn that it's like a gelatin-like type of substance that's inside the pulp. And then inside the pulp, you're going to see blood vessels, you're going to see nerves and nerve endings. This is your pulp canal or root canal. And we have openings at the very bottom. So this is the apex of the root. At the very bottom, there's an opening, and the opening is known as the apical foramen, which again, I'll have a slide showing you this. So the pulp, again, is the most central, is located in the most central portion of the tooth, and it has blood vessels, nerves, nerve endings, so the endings of the nerves, which are typically found near the pulp horns. And it goes all the way down to the apex of the root and beyond. I mean, the nerves and the blood vessels go past that. So if we look at the anatomy of the root, there's two pulps. There is the coronal pulp. The coronal pulp is the one that's on the crown. And then there's the radicular pulp, and the radicular pulp is the one that's on the root. And so my question to you is, where do you think you see more pulp? Do you see more pulp on the radicular pulp, or do you see more pulp on the coronal pulp? Coronal is like the one right here that I'm pointing to. Radicular pulp is the one right here. If you said coronal pulp, you are correct. There's more pulp found in the coronal pulp compared to the radicular pulp, because this is really thin, right? There's not that much pulp inside there, but there's more over here in the coronal pulp. And so there's also an apical foramen. Foramen means opening. That's the definition of foramen, openings. And apical comes from the word apex. So the very apex of the root has an apical foramen. And this is an opening where the nerves and the blood supply can pass through. Fun fact, the maxillary molars, so actually maxillary teeth, so the top teeth, their apical foramens are actually larger than the mandibular foramen. There's also accessory canal. So if you can see over here, there's a branch that sticks out of this canal. That's known as an accessory canal. This is the pulp canal, the root canal. Apical foramens at the bottom, and then there are, apical foramen should be somewhere at the bottom, and then there's other branches that stick out, and these other branches are known as this one right here is known as your accessory canal, and this one right over here, this should be your apical foramen, but this branch is your accessory canal. So humans have 52 pulps in their teeth. How did we get 52? So there's 20 baby teeth, and there's 32 permanent or adult teeth. So if you combine 20 plus 32, you get 52. So altogether, we have 52 pulps in our teeth. And the pulps, they all look the same. They're soft. They have a gelatin type of consistency. In fact, if you take all the pulp out and you measure the volume of the pulp, it's 3.8 milliliters in adult teeth. So in permanent dentition, 3.8 milliliters. That's how much pulp we have. If you were to put all the pulp together, that's how much it is. So let's look at the coronal pulp. Remember, coronal pulp is the pulp that's like right over here. That's on the crown. Okay, that's on the crown portion. It has pulp horns. So pulp horns are these, the corner of the pulp are your horns, are known as pulp horns. And what happens is they decrease in size with age. So if you look at the coronal pulp, in fact, the entire pulp really, this is as you're aging, so you're in the middle age, now you're becoming a senior, and you can see here that when you age, the pulp, which was really big before, gets smaller. So as we age, our pulp gets smaller, and there's lots of reasons for this. It could be because the odontoblasts, so these are cells that make dentin, they keep forming dentin, so we get more and more dentin, less and less pulp. It could be also because, there's trauma, For example, there's more and more dentin being formed. So here, for example, there's trauma, there's a cavity, or there's a fracture, for example. So more dentin will be formed over here. Tertiary dentin or reparative dentin will be formed. So it does diminish, or it does decrease the size of the pulp. And also the pulp has cells, and those cells decrease in quantity as we get older. So the pulp isn't able to thrive as well because of the pulpal cells that have decreased in quantity. Okay, let's look at the radicular pulp. So the radicular pulp is, remember, the pulp that's near the roots. And you can see that it is tapered or conical, so it kind of like tapers off like this, right? It gets very thin, it tapers off, and it does, just like the coronal pulp, becomes smaller with age. The pulp gets smaller and smaller as we age. Here again, we're looking at the picture of an accessory canal. So this is an accessory canal. What I want you to know here is that sometimes if you have infection or inflammation, the accessory canals actually bring the inflammation to other areas, like the periodontium. When I say periodontium, there's a whole other course where you'll learn about this, but the periodontium are the parts that are around the tooth. Peri means around, odont means the tooth. So like the gums, the bone, the cementum, and the fibers, the periodontal ligament fibers, anything that's around the tooth, okay? Infection can spread, or inflammation can spread to the tooth, or from the tissues near the tooth to the pulp. Inflammation can spread through those accessory canals, which is interesting to note. Also, do you remember where the apical foramen is larger? Is it larger on the mandibular teeth, or is it larger in the maxillary teeth? Maxillary teeth. So apical foramen, the opening of the pulp, is larger slightly in the maxillary teeth. So this is the pulp again, and if we were to zoom in and look at it, there are different sections, or various sections that we'll look at. So these are your odontoblasts. These are the cells that make dentin. Then we have the cell-free zone, and the cell-free zone is, actually I have another slide here. The cell-free zone is known as the zone of Weil. Okay, the zone of Weil is this one right here, the cell-free zone. Notice here there's no cells, right? No cells. But here we see lots of cells, and these cells are actually fibroblasts. This is known as your cell-rich zone. Okay, cell-rich zone, lots and lots of fibroblasts. Fibroblasts help makes these fibers, the collagen fibers. And then lastly, we have this layer. It's called the parietal layer of nerves, also known as the plexus of nerves. Plexus means like a network of nerves, and you can see lots of nerves over here. So all this together is known as the odontogenic zone. And if we zoom into the odontogenic zone, we'll see a layer of odontoblasts. These are cells that make dentin. We'll see the zone of Weil, which is like a cell-free zone, no cells over here. We'll see the cell-rich zone, which has lots of fibroblasts. These are cells that make fibers. And then we see nerves. This is known as the plexus of nerves, or the parietal layer of nerves. When we look at odontoblasts, so the purple thing that we're looking at, let's assume that these are odontoblasts. These are cells that make the dentin. They actually change. The odontoblasts have different shapes depending on where they are located. So if they are in the coronal pulp, so this is your coronal pulp, the odontoblast looks columnar. So it looks kind of long. It looks like this. Oops, I didn't mean to. Okay, so it looks like a rectangle, so it's like a long column. If you look at if you were to look at this and zoom in, it would look columnar. If you were to look at the radicular pulp, it would look like a cube, so more like a square. Okay, so if we were to zoom into the purple here, it would look like a square. And if we were to look at the apical part, they're quite flat. Okay, they're really flat. Okay, so columnar, cuboidal, and then they're flat near the apical region. When you look at the odontoblast, so this is an odontoblast. This is the cell, and this over here is called the process. Something we may have touched on last time was that the largest part of the odontoblast is actually the process. The process, which is the thing that sticks out, that's like really, really long. That's the largest part of the odontoblast. When we look at how the odontoblasts connect to each other, there's different types of junction, different types of way they connect. So there's a tight junction. So like this part right here, it's really tightly connected. And when you have a tight junction, nothing can go through. There's no substances that can pass through over here. But then you can have gap junctions. So this is a gap junction where if you zoom in, you can see a little bit of a gap. And these gap junctions, they're openings between odontoblasts, so odontoblast here, odontoblast there, there's a tiny gap there. And that's actually important because this is how electrical impulses can go through for communication. So if this cell wants to talk to another cell, they can communicate that way through these small gaps. Passage of small molecules can also go through here that can feed and, other cells. So sometimes it's nice to have that gap so that the communication and passage of small molecules can happen. And then if you look in between these two cells, we do see a little bit of a gap right here, and it's just like right in the middle here, and that's called an intermediate gap. But what I want you to know is that the tight junction it's tight, nothing can go through. But the gap junction, this is where communication of electrical impulses, passage of small molecules can happen. Don't really worry about the intermediate junction. That is also something that can happen, but it's like it's stuck in between. It's not at the edges. It's right in between. Fibroblasts. So fibroblasts are cells that are in the pulp. It's the most numerous cells in the pulp. So fibroblasts are like the number one cells that you would see in the pulp. And then after fibroblasts, the second one is odontoblasts, which are the cells that make dentin. So lots of fibroblasts are in the pulp. These are cells that build, that make collagen fibers, that make these lines that kind of hold everything together in the pulp. Other cells that we see in the pulp are the schwann cell. These schwann cells are found on top of the nerves. Okay, so when we have a nerve, for example, there's schwann cells right on top of it, and it's a cell that helps transmit pain signals. Okay, so it transmits pain signals. Endothelial cells, these are cells that line the capillaries. So your blood vessels or your capillaries, the border, this is a red blood cell right here, and then you can see this border right here. This is the border or the lining of the blood vessel, and that lining is made up of cells called endothelial cells. So endothelial cells are the cells that are around the blood vessels, that line the blood vessel. There's also lymphocytes, which is a type of white blood cell that help fight infection. But what I want you to know is, in case I ask you in a test, the most abundant number of cells are fibroblasts. Other cells we see are schwann cells that are on top of the nerve, for example, the nerve cells that help transmit pain messages. Endothelial cells, these are cells that line the blood capillaries or the blood arteries or the blood veins. They're the lining. The outer layer of the cell is made up of endothelial cells. Okay, so we know fibroblasts make collagen, right? Which are these like lines, okay? These collagen fibers. And so there's two types of collagen fibers that you see in the pulp. There's actually, in total, there's 4 different types of collagen, but the ones that we see in the pulp are type 1 and type 3. And it's just structurally a little different and found in different areas of the body, so that's why they have these differentiation. But type 1 are collagen fibers that are produced by odontoblasts. So odontoblasts are the ones that make dentin, D for dentin, and they also make fibers. And then we have type 3 collagen fibers, and these ones are produced by fibroblasts. These are cells that make fibers. And what fibers do they make? Type 3 fibers. So know that type 1 fibers come from odontoblasts, type 3 fibers come from fibroblasts. Pulp is very, very vascular. So all our pulps are vascularized, highly vascularized, which means that there's a lot of blood vessels, arteries, veins, and all that in there. There's blood flowing over here, and the blood flow is really fast. And it's the blood pressure, if you were to, that blood pressure, the flowing of the blood, it's quite high in the pulp. Pulp has nerves, and nerves are what transmits pain signals to the brain. And so there's non-myelinated, myelinated, and myelinated nerves, and don't worry too much about it. I'll just tell you really briefly what they are. Non-myelinated nerves are, if you look at the nerve, for example, it doesn't have a coating on top. It's not insulated, whereas a myelinated nerve like this one, it is insulated by the myelin sheath. There's like a sheath that's kind of insulating the nerve. And also with myelinated nerves, there's something called the nodes of Ranvier, which are gaps. And when you have these gaps, what happens is with myelinated nerves, the messages get sent really fast. So if you're in pain, the message will get sent really fast to your brain. But if there's a non-myelinated nerve, which does exist, so there are unmyelinated, myelinated, and myelinated nerves in your pulp, the unmyelinated nerves, because they don't have these nodes of Ranvier, nor are they insulated, it takes a little longer time for the nerve impulses to get transmitted to the brain. So myelinated nerves have a high speed of transmission of nerve impulses, whereas unmyelinated nerves have a lower speed of transmission of the nerve impulses. Near the horns, the pulpal horns, that's where you see the nerve endings. So the endings of the nerves, you can see them really, there's a lot more nerves on the coronal part, and it's also, the nerve endings are very prominent near the pulp horns. Okay, so the pulpal nerve endings are found in the pulp horns. So that's why you see a lot of nerves right here near the pulp horns. Okay, so how do we get that pain message into our brain? Like, there are many theories of how the pain and the pulp work together. So let's just look at the three theories. So one of them is called the direct innervation theory. This theory, the direct innervation theory, believes that there is a nerve that goes straight into the DEJ, the dentin enamel junction. So where the dentin, which is in brown, and the enamel meet, there's like a nerve. So if you feel pain, it goes straight into like this area right here, and it detects the pain, and it tells the brain that there's pain. So there is this theory that says that there's a nerve that's inside the dentinal. So this is dentin, the dentinal tubule. This is the odontoblast right here, and it just goes, and there's one that just hits the DEJ, the dentin enamel junction, and transmits pain that way. But that's not really true. They did studies on this, and they never saw any actual nerve present over here. So then they're like, okay, maybe there's something called the transduction theory, and this might be true. And this is the idea that in the dentinal tubules and in the odontoblastic process, the pain gets sent. Okay, so the pain gets sent through the dentinal tubules, and then what happens is that the nerve endings. So the nerve endings just send the message to the pulp. So again, with the transduction theory, it assumes the odontoblast blast process is like a receptor that catches this pain, and then the pain message gets transmitted to the nerve through the pulp, and then it gets sent to the brain. Okay, so this is a transduction theory, and again, the transduction theory is basically saying that the odontoblastic process is the receptor, and it takes the pain, it conducts the pain to the nerve ending in the pulp. So it just transmits the pain and it goes to the pulp. Again, that's a theory out there, but the well-known theory right now is the hydrodynamic theory. And the hydrodynamic theory is that they have this theory where there's like water or fluid that kind of fluctuates in the dentinal tubule. So when the dentin is stimulated, if there's pain near the dentin, the fluid gets stimulated over here, and the odontoblast process, what happens is that it moves. Okay, so the fluid moves, the odontoblast process is kind of moving as well, and that contacts the nerve. Okay, so that contacts the nerve in the pulp, and then it sends the message to the brain to say that I'm in pain, and I'm in pain because the odontoblast and the fluid moves slightly over here, and then it's transmitted the pain to the pulp. So there's many studies that have been done to support this theory, the hydrodynamic theory, where the fluid travels through the dentinal tubules, excites the nerves, and then sends the nerve then sends the message to the brain to say that I'm hurt, or my teeth is hurting. Okay, so changes in the fluid pressure, changes in the shape of the odontoblast, all that work towards stimulating the nerve. The three theories that are out there. Again, we'll just recap. There's the direct innervation theory, where it just directly sends a message. There's a nerve that directly sends a message to the brain, but that's not really true. There's the transduction theory, where the odontoblast process is a receptor that catches the pain feeling and then sends a message to the nerve. Not exactly. There are some studies that support that, but the number one is the hydrodynamic theory, where the fluid movement and the odontoblast movement triggers this the pain to be sent to the pulp, which then sends it to the brain. So it's the hydrodynamic theory that is supported by studies. Okay, let's look at the functions of the pulp. So lots of different functions that you can see here. So one of them is inductive. The pulp helps start the tooth formation. Remember last time we were looking at this, which is the enamel organ and the dental papilla. So this is how a tooth is starting to get formed. If you remember, the dental papilla is what makes the pulp. Okay, so it's what makes the dental pulp. It's also what makes the dentin too. And so inductive, the function of the pulp is because of the dental papilla, we're getting tooth formation. So it's inductive, it's formative, it forms dentin. There are odontoblasts around the pulp that helps form dentin. It's protective, it responds to stimuli. So anything hot, cold, it'll protect it. It'll protect the tooth because it recognizes the heat, it recognizes the coldness. It also, another interesting thing about the protective part is that it makes the sclerotic dentin. So remember dentinal tubules? So I'm going to draw a cross section of the dentin, and there's tubules. These are the dentinal tubules. Sometimes these dentinal tubules get blocked. So in the primary dentin, we have tubules, and tubules are like these long canals. Okay, so there's these tubules that are in the dentin, and if I were to just draw one of those tubules, and if it gets blocked right over here, that could be known as the sclerotic. It also provides nutrition because it carries oxygen and nutrition to other areas. So the pulp can carry, because there's blood vessels there that can carry oxygen and nutrients to other areas of the mouth. And it's reparative. Remember, if you have a cavity, for example, or if you have like trauma to this area over here, then what can happen, maybe I should change the color. What could happen here is if I have trauma, is the dentin makes, there's other dentin that gets formed here. The tertiary dentin or the reparative dentin gets formed over here. Anytime there's an area of trauma, that's what happens. So lots of different functions for pulp. Now let's look at regressive changes. You know how I said the pulp gets smaller and smaller? Well, let's look at why. So one of the things that happens is the pulp decreases in size with aging, and this could be because the cellular activity decreases with time, so the pulp has cells and that cells isn't as active anymore, and because reparative dentin gets formed. So if you have trauma, so here we had a cavity, for example, and then whenever there's trauma or cavity, reparative dentin, tertiary dentin gets formed, and that just kind of because we get more dentin and less pulp, the dentin kind of takes over most of the teeth. What else can happen? Fibrous changes, so something called fibrosis, where you get more collagen. So more collagen can appear in the pulp. So increased collagen is seen in aging pulp, more fibers. Sometimes you can even get pulp stones, and this is what pulp stones look like. It's like an oval calcified, it's a hard calcified mass. And so there's true denticles. Pulp stones, by the way, are also known as denticles. So there's true denticles and there's false denticles. So true denticles have dental tubules like dentin. So they contain dentinal tubules. So if you look at true dentin, remember these are your dentinal tubules. These are those long tubes that we see inside the dentin. And so if you see a true stone, a true denticle or a true pulp stone, there is a tube. There's a dentinal tube. So you can see it's light over here, dark on the outside to kind of show that it's a tube. But if you look at a false pulp stone or false denticle, there is no dentinal tubule. There is no tube. Okay, so true denticles, a true pulp stone have this dentinal tubule. False pulp stone do not have a dentinal tubule, and these tubules, they could be free, that means they could be anywhere in the pulp, they could be attached to the dentin, somewhere around here, the dentin, or they could be embedded completely within the dentin. Most denticles are false denticles that are free in the pulp. So most denticles are false denticles, which means they don't have a dentinal tubule in them, and they are free. They're anywhere in the pulp, they're free. And lastly, the other thing that we can sometimes see is diffuse calcifications. And all that really means, diffuse calcifications, is that there's tiny spicules of minerals. Okay, just tiny spicules of minerals just hanging out in the pulp. And mostly, if you were to see them, you'd mostly see them in the root canal area as opposed to the coronal area of the pulp. So it's just irregular calcified deposits. They're really tiny. Sometimes they could become large masses of mineral. But if you do see these calcifications, it would happen in the pulp compared to the coronal pulp. So it'll happen more in the radicular pulp compared to the coronal pulp.